As health plans consider implementing new payment and partnership relationships with providers, it's important that they recognize that these relationships will be and will continue to be very complex. There's a variety of different situations, different kinds of patients, and what they're looking at doing is implementing a variety of different payment relationships. And the most important thing for them to consider in terms of this complexity is not to enable the complexity to overwhelm the objective that they're pursuing in implementing these relationships. It's important that what they do is recognize what their objective is and focus on that objective. So, for example, it would be very possible to design a very complex relationship that would in fact provide an incentive for providers to limit access to appropriate care for patients in an attempt for them to maintain their financial viability. So the important thing is to realize that in fact they're looking for improvements in patient care, and they need to maintain respect for the financial viability of the provider organizations, and recognize that both sides are approaching this with a common objective, and that complexities in that relationship should not disable their ability to achieve those objectives. You talk about bundles of care. We've done a lot of work on defining what services are included in a bundle, and that in itself is very complex. We'll never get a perfect definition. If we try to make sure that the bundle includes all of the services that might be related to the particular acute episode, and also simultaneously try to exclude all services that aren't related, that will never be possible. It will be an imperfect result. But the objective is to improve the process of care. So if we keep our eye on improving the process of care, we can sort of overcome these complexities and basically keep our eye on the partnership and the objectives, not on the letter of the definitions and the specifications. I think the complexity of the financial relationship is in terms of maintaining the financial viability of the provider organizations, and we don't want to jeopardize that for the sake of short-term gains, financial gains. So I think that the complexity is in understanding what the impact is, both in short-term and the long-term, on the providers, and the potential advantages for both the health plan and the provider, and especially for the patients.